is a severe and life-altering illness that not only threatens the lives of young patients, but also profoundly impacts their families, requiring urgent attention, advanced treatment, and unwavering support. Every year during the month of September, concerned Barbadians come together to raise awareness of childhood cancer. In this special edition of Info Insight, you will learn of our children's valiant fight with this dreaded disease. We will celebrate the achievements of patients and survivors and consider the future of cancer treatment in Barbados. Let us first hear from Dr. Greg Padmore, a consultant hepatobiliary and pancreatic surgeon, surgical oncologist and general surgeon, and Dr. Chantel Brown-Farmer, a consultant pediatrician and pediatric hematologist oncologist at the Queen Elizabeth Hospital. They welcomed the opportunity to discuss the complexities of childhood cancer with me and began by sharing their perspectives on the significance of Childhood Cancer Awareness Month.
For Childhood Cancer Awareness Month, as the name suggests, we would like to bring the awareness to the public about childhood cancers. With awareness, you hope to get more involvement, support, and of course we have the patients that are going through it who are in remission. We want to improve outcomes and bring to light what is happening here at QAH for our patients in the region, and we're hoping to continue to improve on this area.
Well, it means going gold, so I wore my gold dress today. And obviously at this time I remember all of the families and children that I interacted with who have been and continue to be affected by cancer. But of course it is also an opportunity for me to provide education around the topic of childhood cancer and to try to dispel some of the myths and misconceptions that exist around pediatric cancer. For example, one of the major ones that I'd like to get out of the way is that children don't get cancer. I hear that a lot, despite years of treating children with cancer across the globe. While it may be rare, perhaps compared to other illnesses that children get, the World Health Organization actually published that they estimate some 400,000 children annually across the globe are diagnosed with cancer. And that may actually be an underestimate, because their data is going to be pulled largely from countries of higher income who have the capacity to keep well kept and up-to-date databases. Whereas countries with lower incomes and less resources, they do not usually have the luxury of having these very well-kept databases, and some of these numbers may go to the wayside. And so they actually believe that a lot of the children with cancer across the world lie in the developing countries in the Caribbean and other places in the world. The Sick Kids Caribbean Initiative over the past several years have made data collection one of its major areas of improvement. And we have been able to gather data that lets us know what that is like in the Caribbean. And I can tell you that in Barbados, we diagnose anywhere from about 10 to 12 children per year with cancer. So that's a child every month. So you can get an idea of what the frequency or incidence of cancer, at least here in Barbados, is like. In the early stages, as in many developing countries, you probably had survival somewhere about 30 to 40% initially. That creeped up to about 50%, maybe about 5 years ago. But over the last 5 years, we have been inching right under 70% in terms of overall survival of the children that we diagnose with cancer. And in terms of how that compares to other countries, I would say that in the most developed countries, somewhere about 85% is where they're at in terms of overall survival. If you have to drill down though into the different types of cancer, some types do far better than others globally. For example, in high-income countries, leukemias can actually do quite well. So you can get up to like 90% survival for leukemias because they have access to all of the treatments, the stem cell transplants, and so on. Some of those things we don't have access to here. The immunotherapies, we are steadily getting those available, or at least they become available when I request them sometimes. And our management of children with leukemia has been reasonably good for a developing country. Some of the other misconceptions about cancer include the types of things that you can treat childhood cancer with. So we do get sometimes a lot of parents wanting to use herbal methods, for example, to manage a diagnosis of cancer in their child. And while sometimes adopting a change in lifestyle and diet might be beneficial during the course of treating your child with cancer, it is not the ultimate treatment for cancer. One of the other things that I would like to highlight is that we treat children with cancer here in Barbados. A lot of the times, one of the first things that we will hear when we make a diagnosis is, pointing towards the need for the child to go overseas. And most of the children that we diagnose with cancer are treated right here in Barbados. We have access to most of the treatments that are needed.
It is reassuring to know that childhood cancer can be treated right here in Barbados. Equally encouraging is having dedicated medical professionals like Dr. Brown Farmer and Dr. Padmore at the Queen Elizabeth Hospital who are committed to diagnosing and treating this disease. They share their journeys into specializing in cancer diagnosis and treatment in Barbados.
The majority of my training has been in Barbados at QH through the University of West Indies and the general surgery program. After I completed my degree in general surgery, this would be in 2018, I pursue further training in Canada, in Calgary, in hepatobiliary surgery, which is in essence surgery involving the liver, the pancreas, the bile ducts, gallbladder, and that entails both benign or non-cancerous diagnoses and cancerous diagnoses like pancreatic cancers, liver cancers. But I also did a second fellowship in surgical oncology, which is the surgical management of mainly gastrointestinal cancers, which is cancers in the abdomen, but also breast cancer, skin cancer. So it is a specialty in cancer management surgically. So with that training, of course, it helps me to better able manage these patients, but it takes it a step further where you have expertise in different subspecialty areas and niches in these cancers. So that is where my aim or my goals are helping to improve cancer care for our patients in Barbados.
My path towards pediatrics was straightforward. I always knew that I wanted to be a doctor and that I wanted to be a pediatrician. And I knew that I wanted to be able to contribute to the field of pediatrics in Barbados in some substantial way. And so I did entertain other areas of specialty. But through my interactions with some of the children who would have been on the ward during my period of training as a pediatrician, some of them whom I grew fairly attached to at times, as well as I attended a conference actually put on by the Barbados Cancer Society where they were looking at advances in care for children with cancer and on an international level, as well as as how the experience went for children here in Barbados. And so they had a wide panel in terms of parents who were able to give their views on what the experience was like for them, things that may be better or could be done differently, One of the panelists was Dr. Sheila Weitzman. She is a pediatric oncologist at the Hospital for Sick Children, and she was just very enthralling in her presentation in terms of what they are able to do from the point of view of care, research, comprehensive care package that they're able to offer. And I think it really interested me. And it so happened that I think she became part of that panel because around that time there was an initiative which had started up called the Sick Kids Caribbean Initiative, which is spearheaded by one of our own, Dr. Victor Blanchette, who recently passed away actually. But he was part of our diaspora in Canada, and he had been caring for children with blood disorders and cancers for a long time. And family of his patients in Canada, they'd actually reached out to him and really wanted to do some kind of charitable work and asked if he had any, ways that could be done. And he did suggest, I guess, an idea that he had been playing with that would allow him to give back to Barbados and the Caribbean in terms of forming that twinning initiative between hospitals here in the region and the Hospital for Sick Children in Canada that would allow us to improve what we were able to offer children with cancer here. And it was forming that connection at that conference that eventually led me towards my fellowship in pediatric oncology and hematology at the Hospital for Sick Children. And ultimately returning back home. I've been here about 5 years now, treating children with cancer.
We've explored the importance of Childhood Cancer Awareness Month along with the rates of incidence and survival. But what exactly is cancer, and what risk factors heighten the likelihood of developing it? Additionally, how do cancer occurrences differ between adults and children?
Yeah, that's a good question. I kind of break it down into simple terms. So cancer is where there's uncontrolled growth of cells. Those cells can be whether it's solid organs like the breast, colon, pancreas, or it could be cells in the blood, where different cell lines can proliferate or grow, but not checked by the body.
Every organ in our body, from our skin to our heart to our kidneys, liver, they're made up of cells that are specific to that organ and make them that organ. And they are ever so often dividing and trying to replenish themselves. And sometimes they get a little error and they go awry and start proliferating, not maybe listening to some of the other signals around to stop. And that happens in organs. It also can happen in the blood. We consider the blood an organ. When this keeps going on unchecked, it can make an individual very ill. And that is essentially what cancer is.
For cancers, you generally have modifiable and non-modifiable factors. So the modifiable ones are the ones which relate more to lifestyle.
Theoretically, if you don't smoke, or if you acknowledge that your workplace environment is causing unnecessary and undue exposure to certain chemicals which can lead to the possible development of cancer, if you can get rid of some of those factors, you may avoid or prevent getting cancer, for example.
You also hear about diet, exercise, or the sedentary lifestyle. So those are the factors that you have control over in terms of helping to decrease the risk of specific cancers. The non-modifiable ones are like genetics. So you may have a strong family history of a particular type of cancer, where in those scenarios you may not be able to control it. But the vast majority of patients that we would manage have what we call sporadic. So it just happened to happen due to some form of genetic error. So outside of the modifiable factors, prevention can be challenging.
That brings up probably one of the biggest differences between childhood cancer and adult cancer. And so Dr. Padmore did allude to that a lot of cancer is actually sporadic, but in children that is seldom the case. Most cancers in children are random occurrences and there is no way to prevent them. And then some cancers in children are as the result of what we call inherited disorders. So these are genetic abnormalities that you would inherit from your parents, which then predispose you to getting cancers. But that is just a small subset of the cases of childhood cancer. So one example of that, for example, is children with Down syndrome. They are actually more predisposed to development of leukemias than the other children who do not have Down syndrome.
The types for sure will be different. You do have some cancers confined to adults, but you find too children can have potentially more aggressive cancers, but they tend to be more treatable as well compared to adults. But each cancer type is different.
In terms of the types of cancer in children, you can get cancer in any part of the body in children. But the most common types of cancers tend to be brain tumors and leukemias. Those are the top two, I think, internationally. And then you start to get some variation between things like lymphomas, neuroblastoma, Wilms tumor, which are tumors of like the kidney and adrenal glands, and so on. But for the most part, at least for our region, we have found that leukemia tends to be our number one, and there are many different types of leukemia, and then brain tumors, and then there are many different types of brain tumors that you can get for children specifically. Some of the most common presentations are abnormal lumps and bumps. One of our cancer survivors who spoke to you today, he would have mentioned that he had a lump in his neck that just did not go away. And it is common to get lumps in your neck in childhood, associated with things like cough and colds, but they're usually transient. So if you see something persisting, especially if it's getting bigger, and one of the features of it tends to be that it's actually not painful. So it may be a lump that is not causing you any trouble but is growing. Those are the type of things that you want to get investigated. Sometimes parents may say, well, they thought the child fell, a couple of weeks back and they got that lump, but they are missing the fact that that lump never actually went away. And so it's something that you should have a look at as opposed to putting it down to the fact that it may have been due to a fall that happened several weeks ago. One of the other common presentations would be fever, and fever that persists. So they may have fever and may have some cough and cold or other type of viral type symptoms. And even when those symptoms seem to have passed, they're still having fever. And a lot of the times that may also be associated with abnormal sweating, especially at night. That's a common presentation. Or it may be persistent fever with a limp, especially in a small child. Because, again, one of the most common types of childhood cancers is leukemia, and we make our blood cells in our bones. When that goes awry, you actually get bone pain. And how small children may manifest that is by not wanting to walk because they're having pain, or they may favor a particular leg because that one is causing them a bit more pain than the other, etc.
Fear can have a very significant impact on patient care, right? In the back of their mind, they may know something is wrong, but they're fearful of being diagnosed. But one of the things about these awareness months, like childhood awareness months, is early detection, because with early detection, you have a better chance at cure, right? So that is one of the main things we like to get over to the public about having symptoms and ignoring them, because quite often taking that approach can have a negative long-term outcome. Not always, but quite often.
So my advice would be to see your physician. That may be a family doctor, it may be a pediatrician, and express to them exactly what you're saying here to me. This particular illness seems to have been going on for X amount of time. I am concerned about it. Do you think that we need to do any further investigation? along the lines to make sure that it's nothing serious like cancer. A lot of the times doctors will either immediately be able to allay your fears because they can see and examine the patient and there is an alternative diagnosis, or if they themselves are unclear and they understand that you are expressing anxiety or concern about this symptom that is not resolving, they will assist with further investigation. All things being equal, if it persists even after you see your initial doctor or pediatrician, you can always seek a second opinion, and sometimes that may be what is needed.
Sound advice. Dr. Brown-Farmer continues the discussion with an explanation of diagnosis and treatment processes.
We take it slowly. First, we will speak with the parents and we will explain to them what we are seeing that is concerning and why this appears to be pointing towards cancer. Sometimes it may be that we may have to say, we still need to do one or two other investigations to confirm the diagnosis. But as you can imagine, it's always in the background of one's mind when you come into the hospital that the doctor is going to tell you something serious, like a diagnosis of cancer. But at the same time, you never believe that it is going to happen to you. And so there are definitely a wide range and mixes of emotions that we experience with different families. There can be a lot of denial at the beginning. And so there definitely is a lot of repetition that is required in terms of what we're seeing, how we arrived at the diagnosis. Some families take it in stride, but then later on they may have challenges with coping with dealing with the diagnosis and what treatment actually entails. Because one of the other differences between childhood cancers and adult cancers is that the treatment tends to be much more intensive and a lot of the times a lot longer as well in terms of the duration for which you need to have treatment. One of the major modalities in treating childhood cancer includes chemotherapy. You need surgeons because, as I mentioned, some of those cancers are solid cancers and not just blood cancers, and so it may involve not just the sample of tissue at the beginning, but actually removal of that tumor if you can get to it safely going forward. Radiation therapy can also be involved, and recently quite a few cancers have been using what we call immunotherapies, which are medications that are targeted to specific markers on the surfaces of those abnormal cells. And so theoretically, they have a little bit less toxicity for your normal cells, but they can still make the children feel fairly ill. And there are a wide range of drugs that are used with lots of varying side effects, both upfront side effects, and then one of the major problems in treating cancer in children is that children are still growing. And so those drugs are impacting the cancer cells that we want to impact, but they're also impacting growing cells. And so there are a lot of long-term side effects that we have to look to down the road and screen for even after you've treated a child with cancer. Things like decreased heart function sometimes after you get some chemotherapy drugs that might not always be near to you getting the actual drugs, but later on in life. So it's something that you always have to remind your doctor eventually that they need to kind of check on. Sometimes we have to think about things like how our organs that control how we grow, like our thyroid and other organs that help children to go into puberty, may also be affected. So some children who have had chemotherapy early on before they've entered puberty may have delayed growth, delayed puberty, and those are things that we would address with other specialists that can help those things to kind of come on as close as possible to the normal time frame as we can. The most common side effects would be at the times when children are getting the chemotherapy, which include things like nausea and vomiting, and hair loss, as well as skin changes. We always expect or try to anticipate nausea and vomiting. So in addition to giving children the chemotherapy medications, they get medications even before they get their chemotherapy to keep nausea and vomiting at bay. So what we would call anti-nausea or anti-vomiting medications. And so a lot of the times they anticipate it, but they do not actually experience significant nausea and vomiting when we are able to get a good balance. Every child is not the same, and so there will be some children who still have quite a bit of nausea and vomiting even with the medications that we put into place. Hair loss is always one of those things that families can struggle with, even though we do tell them beforehand that this is something that is going to occur. And we find the boys tend to do fine with it. The girls probably not as much. Sometimes we also can reach out to hairdressers in the community, as we have done in one or two instances, to help our young ladies still feel beautiful as they are, and to have a nice wig and so on while they're going through their treatment. Unfortunately, getting chemotherapy and radiation therapy to treat cancer can put you at a risk for other cancers later on in life. And while you may not have to think about that for an adult patient, it's something you have to think about for a child because they're still growing, and obviously our goal is to get them into adulthood and beyond. So those are things that we do then end up having to screen for intermittently as they age. The longest duration for treatment of cancer would be for the children with leukemia, and you're looking at somewhere about 2.5 years for the majority of them. And that usually starts with about 8 to 9 months of intensive treatment up front, and then the rest of the treatment is what we call maintenance treatment, where they can still go to school, but they're still receiving treatment at the same time. In the beginning, lots of the treatment is going to be in hospital. And I think for the majority of cases, families can expect to have their children in hospital for anywhere between 4 to 6 weeks for the treatment of most cancers. Mostly because the child is acclimatizing to this type of medication. That is the period where they're most likely to get the most sick from that type of medication, because chemotherapy can actually predispose you to serious infections, which we may have to manage. It drops blood counts, and so we have to support them with blood products like red cells and platelets and so on. And so that initial period can be very challenging for families. But as we move forward in treatment, we always try to find ways to have them largely managed as an outpatient. So they can come in, get the therapy, and go home and be with their family, interact with their siblings, still try to do some of the things that make them children. And we're very cognizant of the strain that it can place on some families as it relates to financial obligations. If one parent or both parents have to kind of interchange being with the child in hospital, then it means that they're not earning the income that they would normally earn in a lot of instances. Some workplaces are a bit more forgiving than others. And we try to be cognizant of that as we get deeper into the therapy, so that the family has a little bit more flexibility with dealing with their child with cancer. We also engage supportive services like the Barbados Cancer Society. We have social workers here at the hospital who we ask them to get involved because they are always aware of other services in the community that they can tap into for specific family needs, because every family is different. And even though we do not have on staff psychologists specifically for this reason, we have psychologists on staff for other reasons, we do reach out to them and ask them at times to meet with some of our families who seem to be having the most significant challenges. And they are usually very receptive to that and willing to help us with counseling with some of our families.
Now, while cancer can provide a number of life-altering challenges, Nathan Phillips refused to be defined by it. Diagnosed at the age of 10, the now 14-year-old Combermere student stands a proud cancer survivor and a testament to the power of hope, faith, and the resilience of the human spirit. Dr. Brown Farmer reflects on Nathan's journey.
When I met Nathan, he was a lot shorter than he is now. He was probably about 10, and I do remember him being referred into the pediatric clinic. So I have two clinics. I have a general pediatric clinic, and then I have the hematology oncology clinic. And he was referred into the pediatric clinic because of a lump in his neck.
At first it was a bump on my neck over here, and then when we went, they said it was a lymph node, might either be cancerous or an infection.
I recognized that there were also some other strange symptoms, like persistent nasal discharge as well, even though he didn't really seem to have a cold per se. And so that prompted certain investigations, what we call scans, like CT scans, to see if there was anything else other than just that lump that we could feel. And what we ended up diagnosing was something called nasopharyngeal carcinoma, which involves the tissues at the back of the nose and in the throat.
They said it was cancer, and my mother, they started feeling weird, and after that we got admitted to the hospital. It wasn't all that bad though. I like interacting with the doctors, but the treatment itself.
That treatment would have involved a course of chemotherapy and quite a bit of radiation therapy actually to his neck area in order to get the cancer to go away.
The first time I had chemo and I went home, I remember I went to sleep, and after I went to sleep I woke up, and when I woke up I feel like I couldn't move. I feel like I was paralyzed, and after that things went downhill. You know, that time it was my mother and my father, they helping me. And so many times my mother would rub me up with olive oil and start praying me, and then I would fall back to sleep, and after that, normal.
He was treated successfully. Treatment for that is usually under a year in terms of duration, and he's been cancer-free ever since.
Advice I would say is to put all your faith in God, and just keep that you could live and push through it.
Wise words from one who has indeed lived it. Charlicia Charles is a cancer patient in the maintenance phase of her treatment. Diagnosed at the age of 13, Charlicia traveled to Barbados from Dominica seeking treatment. Dr. Brown Farmer provides details.
Well, she is an example of persons from some of the other islands in the region reaching out to us to come for treatment because they have even smaller numbers of children with cancer that they see, as well as they do not have the luxury of having a pediatric oncologist on island, somebody to guide what can be very different treatment for leukemia in children than would be in an adult situation.
My first time when I was feeling sick, I was feeling dizzy, sometimes nauseous, and so I decided to go to the doctor. And there they took blood tests and they saw that my blood was really low, and they rushed me to the hospital. From the hospital, they had to do tests to see what was wrong with me, and I found out I had leukemia. I was accepted in the Queen Elizabeth Hospital.
We had to walk slowly with her because this is one of the instances that I mentioned where you tend to be in hospital for a long time up front, and we have to constantly reassure it's going to get better. You're going to be able to go out of the hospital for long stretches and just come back in for quick treatments and then head back out.
Doctors were really amazing giving me treatment. I felt comfortable. Even though I was going through pain, they would always try to make me smile and making sure that I was good. And as time went by, I started feeling better. The needles, taking blood, it was really hard. My veins started getting small. It wasn't getting much blood, and so they had to put a chemo pot to help with release the pain. But knowing that as time went by, it would get better, and I was looking forward to getting better.
Now we're in a part of her therapy called maintenance therapy, where most of her medication is oral. She doesn't have a lot of intravenous, like dripped medications to be administered, but they are in a transition period between here and going back to Dominica. There are just some things that need to be kind of sorted out in terms of who is going to be able to take over once they go back home.
And we wish Charlicia well with her treatment. Now, ever since its establishment in 1980, the Barbados Cancer Society has stood as a beacon of hope. This is evidenced through its dedication to prevention, early detection, education and advocacy, as well as its provision of invaluable support to adults and children facing cancer. The Society's very dedicated client services and welfare officer, Olivia Thornhill, speaks of the mission of the Barbados Cancer Society and explains how she became involved with the organization.
The mission of the Barbados Cancer Society really is to alleviate pain and suffering from cancer through early detection. I started at the Barbados Cancer Society as a volunteer. I joined their volunteer program, which does the outreach services in the Queen Elizabeth Hospital, and I would have joined that program back in 2007, where we usually go into the outpatient clinics and engage with the patients who are attending the clinics, and where we would have had a program at that time where we would serve refreshments to the persons who are waiting to be seen by the doctor. That's where I actually started as a volunteer. So my work entails everything that has to do with the development of programs for the client services and the welfare. We work with both adults and children who are diagnosed with cancer. We also have programs that cater to the needs of caregivers and also survivors. We do visiting in the hospital. We do visit the patients who are admitted to hospital for treatment. We still visit the outpatient clinics, which would be the hematology and oncology outpatient clinics in the hospital, because most of the time that is where we meet the clients who reach out to us for services. That's where we liaise as well with the medical healthcare professionals, the doctors. We usually refer patients to us who are in need of emotional and other forms of support. In my area, which is the welfare area, we primarily engage with clients after the diagnosis. So we provide emotional, financial, social forms of support for persons after diagnosis.
Through my role at the Cancer Society, which will be involvement as well in the Welfare and Client Services Subcommittee, we see different aspects of the patient's journey. You definitely have anxiety for sure, especially if overseas care may be needed. Trying to find different avenues to access those services overseas. Of course, quite often financially is going to be the challenge often in the public setting. So patients would reach out for support.
We provide financial services in the forms of assistance with paying for medications, special scans and testing for clarification and diagnosis. We also provide free transportation services to hospital appointments for both adults and children. We provide school supplies, provide nutritional care items, nutritional supplements, a wide range of services really to help persons diagnosed with cancer to thrive and still be highly functional in their day-to-day living. The hospital's outreach is a huge part of the service we also provide, because we do weekly visits in the hospital where we visit patients regardless to where they are admitted. So it's a number of different wards we visit to sit with patients and spend time with them and encourage them and uplift them and share some information as well.
Happily, the Barbados Cancer Society continues to be creative in its provision of emotional and psychological support to all affected by cancer.
The Barbados Cancer Society has recently launched its Cancer Survivor Network, which is a support group that caters to adults, children, survivors, and caregivers impacted by cancer.
It isn't just the patient, as you know, that goes through it. They have their family as well, and we do well with the medical side of things, getting treatment started, surgeries, etc. But the psychological support, who families can discuss and reach out to, that sometimes can be lacking. So that's one of the areas at the society that we have tried to start, so that we have that network for patients to discuss with each other. It's not just active patients with cancer, patients who would have been in remission, they also come and they provide that avenue for patients to discuss their journey, because every person's journey is different. But one of the things I find is you do have some negative connotations with cancer, and it can deter patients from getting treatments that are needed. So I think having that support is quite important, where they have a source of good information, because not every patient will express their fears. They may not voice their concerns, and then they may go and rely on others to tell them. And sometimes that can change their trajectory in terms of treatment. So it's important to have that, because sometimes the doctor-patient relationship, as much as we try to make sure the patient is comfortable, some patients may not feel comfortable disclosing their fears. So we provide that avenue for a little more laid-back setting to discuss the course and what support services are available.
Our support group is really catering to the needs of all persons, and we especially are looking at children, because before we hadn't heard of any group that addresses the issues that children are facing, and parents who have children who've been diagnosed with cancer. So we are especially looking into that area and making space for those persons to come in and receive the counseling they need. We are looking at speaking to the children in the presence of the parents, speaking to the children individually, and also inviting other family members as well to come in and share and see how best we can help them cope with the challenges faced by the cancer.
But how could anyone assist the efforts of the Barbados Cancer Society and individuals affected by cancer, Dr. Padmore?
So there are different avenues. The Cancer Society is a charitable organization, so everything we do relies on persons supporting, whether it's financially, could be like gift vouchers, grocery vouchers, etc. Any support is always utilized to help with patients through their journey.
We need financial resources. That is always at the head of the list, because it takes funding to run the Cancer Society. It takes funding to make sure that our programs are effective. And so that is one of the main resources. Also volunteerism. We are always looking for persons to give of their time and their skills and their knowledge to the organization. We're always looking for volunteers to help us in our fundraising initiatives. And so those are a couple of the resources we would always need: volunteerism and funding and so on.
So there will always be resource challenges when you are managing cancer, not just childhood cancer, but any type of cancer in a resource, what we would consider a resource-limited country. That includes even things like access to blood products. And so I would use this opportunity to encourage the Barbadian population to become regular blood donors. That is a free way that you can get involved in helping your fellow persons in the community with cancer. If there are constant supplies of blood and platelets, then we are able to manage children and adults with cancer more effectively, because one of the main problems can be giving the medication, knowing that blood counts and so on are going to drop, and then not having unlimited resources as it relates to blood products to replace. Occasionally, there are challenges with availabilities of medications, as can occur with small countries because we do not command large volumes of these medications from overseas suppliers. We have been lucky in the field of childhood cancer to have assistance with that from our connections with the Sick Kids Caribbean Initiative. For example, for management of our children with leukemia, we actually have a protocol joint with the American Society of Hematology, a relationship that was forged because of our relationship with the Sick Kids Caribbean Initiative. And they have connected us with suppliers who have donated some of the drugs that we use to treat children with cancer. And so our supplies for some of those drugs are not necessarily compromised. But at times, there may be challenges sometimes with availability of drugs, but we usually work to get them rectified very quickly.
Although we are a small island developing state with limited resources for cancer treatment, we can still look to the future with optimism. Dr. Brown Farmer shares some of her hopes for the future.
Overall, my hopes are that we become one of the go-to facilities in the region for the management of children with cancer, because we recognize the importance of managing children with cancer, even in terms of long-term contribution to our economy. Saving the life of a child could potentially mean saving that significant contribution that they can make at a later stage. And if we're talking about 10 to 12 children every year, especially in the environment that we're in, our Prime Minister is constantly telling us about the need for our population to grow. Those are precious lives that we do not want to lose. And so I would love to see a national cancer plan that involves pediatric cancer and how we can manage what is significant chronic disease as a community and as a health ministry.
I would hope that whenever a child is diagnosed with cancer, that there is a comprehensive approach to the care of that child. I would hope that there is a discharge management plan in place for that child, because many times parents leave would have been given advice from the doctor, but you also perhaps would need to have the doctor, the social worker, the nutritionist. We need all these people in the same space discussing what is relevant to the care of that child. And on that child being discharged, you would want to know that the parent feels confident that they have all the information that they need when they're in the home, that they are able to address the needs of that child because they would have received all the information necessary from the persons who are qualified to give that information to them.
I think we're slowly making progress. It is heavily multidisciplinary, so not only having surgeons there, but we need to have all the support services involved and adequately staffed, right? So for example, oncology, we need to have adequate number of oncologists present. We need to have support services present, psychologists, social work, even diagnostics, for example, like CAT scans, getting appointments. All of these services come together to help to optimize the patient's outcomes, because you find that when things can be done in a timely fashion, outcomes can be improved. So it is important to understand it is multidisciplinary, and we need to have adequate staff in each aspect or each department that is involved in that patient's care. So I'm hopeful in the future that we can see that, because then with efficiency, we can improve patients' time to get tests, treatments, and then hopefully their positive outcomes.
Dr. Pradmore providing a positive outlook for the future of the treatment of childhood cancer in Barbados. The Barbados Cancer Society needs your support. We invite you to engage with the Society and become involved in their efforts to provide that much needed support to the children and families affected by cancer in Barbados. Your support and outreach are in keeping with who we are as a people as we continue to look out for the interests of others in our communities. This has been a special edition of Info Insight, recognizing Childhood Cancer Awareness Month and celebrating the supportive role played by our people in the lives of others. I'm Miles Eversley. Every blessing.